Hi everyone, good evening. Sorry for the late start. We shall begin hopefully in about 2 minutes. I'm gonna shoot for a 2 minute start time from now. So just hang in there. We'll be beginning shortly. Good evening everyone again. Okay, so let's begin, shall we? I just included in the comment section or the chat section the link for the handout for the class. I'm going to invite you to go ahead and download, click on the link to find the document that you can download um, to show you that you can use to follow along as we go through this lecture. Now, I'm going to ask that you please don't ask me any questions that might get me in trouble, because if you ask a question, I'm going to be tempted to answer. And because I'm a little bit tired, my sense of restraint is not the best. So just ask nice, easy questions that I won't have to step on anybody's toes, because I don't want to do that. All right? So let me just bring up really quickly here the lecture information. So please, as I indicated before, click on the link so you can follow along with us via the handout. Now, the handout normally is a fill in the blanker, but at this time we're using a already completed form. So that makes it easier for you. It's an already completed form. All right, so this is what the handout will look like, except that it's completed. This is a QR code if, in case you're like these fancy people who like to scan things to get to where you want to get to. You can just use this QR code and scan it. But as I indicated before, I've already posted the link in the chat. That's way easier. Not as fancy, but way easier. So just click on that link and it should take you to our class. Now, we're going to be talking about the 7 keys to getting and staying well. So it's a wellness discussion. It's a discussion. It's a lecture. So for those who tuned in and thinking that we're going to be doing exercises or what have you, no. This is just a lecture. So you can sign off now if that's not what you want to do. But if you're a patient of ours, whether or not you are, and you want to hear some advice medically, then maybe you want to tune in. All right, so sick care versus healthcare is the first key. And as we are going through these keys, if you have any questions, please feel free to just write a comment in the chat. From time to time, I may ask for participation, so just respond via the chat as well. And you can also let me know whether I should do this as a part Zoom presentation, so that way if somebody wants to ask a question verbally, they can ask it verbally, and we can interact that way. But if we're gonna do it via Zoom, I'm gonna want to see you. I don't want to just see a name. I'm going to want to see you. So that might not be the to your advantage, but at least it will let me know that I'm not speaking to myself, and that there are actually live people there who are following along with us. So the first key, sick care versus health care. Understanding the difference between the two. And it's important that we do, but when I talk about sick care versus healthcare, I'm going to be referring to the healthcare system based on the primary type of customer that they service. And because they service primarily people who are sick, people who are ailing, I'm going to refer to them as a system as being a part of the sick care system because they're caring for the sick. Please do not read anything more into it. This is not intended to be some kind of a roast on the medical profession. This is just to create a distinction. And I think this distinction is going to be important as you realize as we go through. Because the challenge with the sick care system is that it focuses primarily on responding to issues that are already present. That's the primary way that it operates, focusing on issues that have already arisen within a patient population. So somebody has to already have a disease, or already has to have an illness, or already has to have an infection, or already has to have an injury in order for that system to become effective. And let's not get it wrong. I mean, the system as it exists is by far the best system in place to handle medical emergencies, without question. But the good news for us is that most of the issues that people have today are not medical emergency type issues. Most of the issues that people have today are lifestyle issues. And so if you want to be healthy, you have to work on the front end, not the back end. You have to work from before something goes wrong, not after something has already occurred. So as I indicated here in the first 2 bullet points, because the system responds to something that has already happened, we say that that system is a reactive system. versus true healthcare. If you want to be truly well, then you can't simply wait for things to go wrong. You have to act before they go wrong. And the best way to describe that is saying that the true healthcare system is a proactive type system. I hope that makes sense. Proactive meaning we do things first so as to prevent something that we do not want to have happen down the road. All right? We do something beforehand to prevent something negative from happening later. That's being proactive. Now, the system that we have today, unfortunately, is a system that, in my opinion, which I think is probably true, and you can um, agree or disagree. If you choose to do either, feel free to comment it in the chats. But the system as it exists today is a system that is focused so heavily on reacting to illnesses that there are two primary tools that are used for issues that sometimes do not require those two tools or either of those two tools. One is medications, the other is surgeries. Drugs and surgeries are the hallmark of the sick care system. If something happens to somebody, you go to the hospital, one of two things will happen or both will happen. You will be given medication for the ailment or to ease your suffering from an ailment, and or you'll be given some kind of a surgical intervention to try to restore some amount of normalcy to somebody's life or even to save a life. All right? So those are the two ways that they intervene. However, the main type of person that goes to a hospital setting, for example, is actually not there because of an emergency. Most people in a hospital today are there because of chronic lifestyle diseases. Chronic lifestyle diseases that are completely preventable if they live a particular way. We pretend as though it's good luck if somebody is experiencing or manifesting health. Today, most of the times we fail to even ask the person why it is that they think that they're healthy. And being absent of symptoms does not mean you're healthy. Let's get that straight, all right? Because there's some people who are asymptomatic, though they are very sick and just don't know it. So good health does not mean that you appear to be healthy, and we're going to talk about that a little bit later on. Good health means that all functions are working the way they should be working. And for somebody to experience good health now, you have to be making choices that lead to your health being good. You can't simply just end up there by happenstance because you just happen to be born and blessed with the right genes. Now, there are two ways that people think. And if you want to improve somebody's or change somebody's behavior, the best way to change somebody's behavior is to change their belief. Because your belief drives your behavior. Your belief system determines how you react or respond to things in your world. Your worldview determines your response to world events. And so it is important that we understand that. Having said that, most people are conditioned to think, in my opinion, in a very sick-centered way. And this way of thinking, unfortunately, is a way that is taught to us by way of mainstream media or our family physicians or some doctors in our lives. Because this is how they were taught, this is how they teach us. Think in terms of an illness paradigm. Now, what do I mean? I mean, for example, if somebody has an illness, whether they have a headache or some, pain in the foot or stomach ache, the first thing they want to find out is what can they take in order to feel better. And you know why that's the first thing that people want to find out? The reason they want to find out what to take to feel better is because they see it on TV all the time, ads promoting that response to an issue that you have. You see somebody walking, they're looking embarrassed, they have itching skin with scales on the skin, they're wearing a long sleeve shirt to cover it up, and the next question is, what can they take to start to feel better? And some drug is brought on the screen, and then they are told this is what you take to address this symptom that you're experiencing. The only problem is there's no fixing involved. None of these drugs that we see advertised on TV today or on social media today, none of them correct the underlying issue that the person has. They all work at the level of the superficial symptom management. Now, there are certain drugs, however, that do go closer to the source of the issue, meaning, in the example of an infectious agent, there are antibiotics that are given to try to kill the pathogen that is causing the infection to occur. But there are consequences to that as well. And somebody can please ask me, what are the consequences to taking antibiotics? So I can answer it, and feel comfortable knowing that somebody asked the question, and that's why I'm not just volunteering the information. Because it's somewhat controversial, so I don't want to jump into controversy unless somebody wants to know. But rather than simply saying, what can I take in order to feel better? Why don't you ask the question, according to a wellness mindset, what do I need to do in order to get better? Because getting better is far preferred than simply feeling better. And so we encourage persons to think along the lines of wanting to restore their health back to how it was or back to a higher level, rather than simply feeling as though they're healthy when in fact they are not. Another way that people think according to the illness model is as it pertains to getting well or wellness. They believe that wellness is a destination, somewhere something to arrive at. When in fact, wellness is not a destination but a journey. And so there's a big difference between destinations and journeys. And I'm going to encourage persons to start to kind of think with me as I try to explain this. That wellness is more about a journey, not a destination. And why it is preferred that you focus on it as a journey. If your goal, for example, let's say you are overweight and your goal is to lose 30 pounds. And you start on a journey to try to lose these 30 pounds. And every day you check the scale starts to tell you that you're doing well or you're not doing so well. You've gained 5 pounds or you've lost 10 pounds, whatever the case is. Then what ends up happening is your response is going to be based on what the scale is telling you. And that will be your motivation to continue or not to continue. But the worst thing for somebody, if their goal is to lose weight, is not losing weight, The worst thing is not maintaining the same weight. If your goal is to lose weight, maintaining the same weight is not the worst thing that can happen. You know what the worst thing that can happen to the individual is? Actually losing the weight. what am I saying? How can losing the weight be the worst thing that can happen to somebody who is trying to lose weight? Because invariably what happens to the majority of people is this. There are some people who are not like this. This is not a rule. This is just how it is with the majority of persons. But the majority of people are like this. They want to lose 40 pounds. It may take them 20 weeks or 7 months or 3 months or 6 months or a year or 2 years. You see, once they've lost those 40 pounds, I have arrived, I've met my goal. And they start to relax the effort. Once they relax the effort, things start to come back. And here's the problem, is that the majority of persons, when they try to lose weight through restricting their calories, and I hope somebody will also ask me about restricting calories and why that's a poor way to address health. But when you restrict your calories, what ends up happening is your body thinks that it's starving. And so it tries to store. When you're in a starvation mode, your body does not think burn. It thinks store, conserve. It's like you have a bottle of water and it's the last bottle of water and you're walking in a desert and you know you're going to be thirsty. You don't take the bottle of water and just gulp it down one time. What you do, you sip it because you want to try to stretch it out, make it last, right? And so this is the kind of thing that we see. And so persons who end up losing the weight, they end up having a situation where, because they restricted their input and the body went into a starvation storage mode, as soon as they ease off the pressure a little bit, or as soon as the body acclimatizes to the changes that they had put in, then they start to store weight and pack on back more pounds. And at the end, they're either back to where they were or heavier than what they were. And so their state finally is worse than the state initially. And this is what happens to a lot of people. So I don't advocate using wellness as a goal or a destination. I advocate it as more of a process or a journey. So rather than thinking, get well, how about you think, what do I need to do in order to stay well? Now, when you think about staying well, you're thinking about doing something on an ongoing basis. Instead of thinking, all right, I want to lose 20 pounds, you're thinking, I want to live a healthier lifestyle, whatever that takes. And so you start to eat a certain way and you realize, I am living a healthier lifestyle. Guess what? I want to continue to live a healthier lifestyle. So you continue to do these things. Weight loss might be a part of it, but it's not the goal of it. So when you make wellness a part of a process, you are far more likely to manifest success in whatever your endeavors are, rather than making it about a destination. Alright, so hopefully that makes some amount of sense. Staying alive is how some people measure health. They say that certain populations of people are healthier than others because they have a higher life expectancy. Do you know the number one thing that determines the life expectancy of a population? The number one thing that determines the life expectancy of a population is not how long old people live. It's how young children die. That's the biggest determinant of the numbers that look at your life expectancy in a population. It's how long, is how you prevent children from dying as opposed to how long old people live. Because let's think about it. If you have 10 old people that you can improve their health, and instead of dying at 75, they die at 80, you have added 5 years per person or 50 years to the total life expectancy of your group. Now, what if you were to think instead you had a situation where instead of a certain number of babies dying in infancy, whether it's through malnutrition or through hospital practices or through lack of medical care, and you can save the life of 5 babies in infancy. 5. How long might those 5 babies live? Usually, babies live decades before they die. Usually. Some may die earlier, but some will live for 20, 30, 40, 50, 60 years. So let us say all 5 of them lived for 20 years only before they died. That represents 100 years added to the life expectancy for 5 children versus 50 years added to a life expectancy for 10 senior citizens. Which will have the greater impact? It will almost always show a greater impact if you can save the lives of children. So when you see life expectancy numbers, and some numbers are 80.5, 78 point whatever, that's more a measure of how well that country is doing saving the lives of children rather than how well the country is doing in terms of making sure that old people are living longer. I don't know if that makes sense to you. I hope it does. I hope it does. So, staying alive can't be the goal. The ultimate goal of our efforts is really to feel alive, having quality of life. That's what's important. Having a good quality of life. So, what's the purpose of living for a long time if you don't also feel good? You know what I mean? You want to feel good. You want to be vibrant, full of energy, full of vibes, full of vim, vigor, and vitality, as was said politically a long time ago. The second key is the truth about pain. Question is pain a good thing or a bad thing? And I encourage you to answer in the chat. Is pain a good thing or a bad thing? Feel free to answer in the chat. Is pain a good thing or a bad thing? What we do know, okay, Nicolene says pain can be a good thing. Anybody else? Now, whether good or bad, pain has a purpose. I'm sure everyone agrees that pain has a purpose. Question is, what's the purpose of pain? Now, yes, one can say it's good or bad, but there's a purpose to it that we can all agree. And the purpose to pain is that it alerts us that something has changed and requires our attention. That's the purpose of pain. Tell us that something has gone awry. We need to do something about something. Something is not right. And so this is the purpose of pain. But there are limitations to pain. And many people don't realize that pain has limitations in what it can or cannot tell us. Pain can't tell us how severe something is. Just because your pain is intense doesn't mean that the problem is severe. And just because your pain is mild doesn't mean your problem is trivial. So your pain doesn't dictate necessarily whether something is serious or not. The second thing is, it is possible to have pain, or it's possible to have a problem without necessarily having any pain to alert you of that problem. It's possible to have a problem and not have any pain to alert you of that problem. Case in point is cancer. Cancers, generally speaking, are asymptomatic in the early stages and only start to manifest later on when the disease process is far gone. At which stage, that's when some of the pain might be associated with it. But in early stages of cancer, most cancers are totally painless. So the problem with pain is that you can't trust pain to tell you whenever something is wrong or not wrong. And having good health does not mean or feeling good does not mean that you have good health. Good feelings and good health are not equivalent. If you want to know if you're doing well health wise, then you have to find a way of assessing how your different functions are working. Because it's function that matters, not feeling. It's function that matters, not feeling. So in this um, slide, we're showing you levels of the spine and what they control. Or not levels of the spine, but different systems of the body and what's involved in the different systems. So we have the musculoskeletal system, the nervous system, the immune system, digestive system, cardiovascular, integumentary, which is skin, respiratory for breathing, endocrine, which is heart and lungs. Sorry, endocrine. Sorry. Cardiovascular is heart. Respiratory is lungs. Endocrine is your hormones, your secreting glands and hormones. Reproductive system is you know those parts. And then your excretory system. These are different systems of the body. If these systems are working well, then your body is working well. If any system is not working well, then your body is diseased. Your body is sick. Something is wrong with it. You're only healthy when all the systems of your body are working. Even if you feel so, let's move again because I want you to see the next slide, which is the nervous system slide. And with the nervous system, there are certain systems of the body, but there's one system that is the major system or the master system that controls all the other systems of the body. And if you're paying attention, you'll see behind me, it's the nervous system. That's the master control system of the body. It governs the response of every other system. And if you look closely at this slide here, you will see the different organs and glands and so on. And every single one of them has a connection back to the spine. And it's connected to the spine in two ways. The first way is by way of the blue nerve fibers, and the other one is by way of these yellow nerve fibers. And these nerve fibers are not blue or yellow in our bodies. We just label them as such, so it's easy to see which is which. But for each of the organs, one fiber acts as the accelerator, the other one acts as the brakes. And so your body requires both in order to function normally, not just one, both. So the nervous system is the mass control system of the body. Misalignments are called vertebral subluxations, and they cause nervous system dysfunction. And so if you look at this particular image behind me again, what you will see is that there are certain nerves that exit the spine that go to different parts of the body. if you look carefully at this particular one in the middle, you'll notice that the bone in the middle, this third bone here, that middle bone, has been displaced. It's not lined up with the other bones anymore. And because of that, the nerve that exits between that bone and the one below it may become compressed. And if it becomes compressed, then you will find that whatever that nerve controls will be affected as well. Whatever that nerve controls will be affected as well. So if you have a compression of the nerve that controls your swallowing mechanism, then you won't swallow properly anymore, and you will have what they call acid reflux, because your swallowing mechanism is not working properly. Whatever the nerve is that's affected, whatever that nerve controls will also become affected. And this is what you will call your symptom. So the goal cannot be to treat the symptom. The goal has to be treating the underlying cause. And I hope that makes some sense. Karen, I see your question that says, which side is the brake side? I may have, if I had said that, I may have misspoken, and I can't right now stop to get it back. So I'm not sure. So if I had said brake side, my apologies. My apologies. And good evening, Angie, and good evening, Gary. Welcome to our little presentation here. Thanks for joining us. All right, so let's move forward again. And for those who are joining us later, you missed any part of this presentation, you can always rewind it. Just click on the slider and drag it to the beginning. And if you want to get back to the live, just click on where it says live, and it should take you back to what's happening currently. All right, now there are three types of stresses that occur: physical, biochemical, and psychological. And these stresses are the things that break down our systems and cause us to get sick. So the physical stress might be like a car accident or a fall, something traumatic may happen to us. A biochemical stress might be a chemical that we were exposed to, whether it is deliberate or accidental or inadvertent. So like the air that we breathe, the water that we drink, soft drinks that some of us drink, milk that some people drink, and different things, right? And then you have the psychological, which will be the neuro-emotional parts of things. So you might have a job that you don't like, and so you're stressed out at work. Or you may find that you have somebody in your home that you and them agree, and so they're talking, and as they're talking, it's stressing you out. These are the different ways that stress can manifest in disrupting your body's function. The healthier the nervous system is, the better it's able to adapt to our environmental stresses. It's our nervous system that helps us to adapt, because our nervous system is what allows us to experience our world. So we can't hear somebody shouting at us if we can't hear. You know what I mean? Or we can't have a fracture somewhere if something did not cause the fracture to occur. So these are all important. I'm going to skip through this particular slide because I want to get to this point here, how chiropractic works. Chiropractic works by improving the way our bodies adapt to our environment. Our bodies adapt to our environment by way of our nervous system. So if your nervous system is working better, then your adaptation gets better. And so the gap that you see written down here stands for general adaptive potential. It's your ability to adapt to your stressors. Chiropractic, because it improves your nervous system function, we say that it widens our gap of responding to our situations in life so that we don't break down, or it's likely that we do not break down. At our office, we actually look to try to identify misalignments wherever and whenever they happen. It's not just misalignments only, but any interference in the system. We use muscle tension scanners called a surface EMG, and we also use a hand device that you put your hand in that measures the sweating response in your fingertips. As well as one that measures the temperature of the skin. Now, the temperature of the skin is given by this instrument here on the left, and the muscle tension scan is given by the instrument here on the right. I didn't have one to show you, the stress one, but that stress one is actually very interesting. All right. What kind of doctor is a chiropractor? There are people who are confused about what chiropractors do and how they differ from therapists. So a therapist typically works on a body part to influence the function of that body part. Whereas chiropractic works on the spine, though it's a body part, the goal of the adjustment of the spine is to effect a change remote from there. Is to effect a change within the body that is far removed from what you originally would have thought would be the spine. So somebody has a digestive issue and they get a chiropractic adjustment, can they get better? And the answer is yes. Somebody has a heart issue and they get adjusted by a chiropractor, can it get better? And the answer is yes. Will it get better? I can't answer that question. It depends on the cause of the problem. Because there are certain neurological things that can cause psychological concerns. That's important. Right? Now, when you look at the function of the chiropractor, if what we do truly works, then what you will find is this. The nervous system, if it were to improve, must also have some impact on how the brain reacts. Because the brain is the major organ of our nervous system. If our nervous system changes, then our brains by necessity have to change. And so this particular test that was done, where a lady was asked to do a functional MRI to look at her brain before and after an adjustment following a particular task. So she was asked to wiggle her left ankle and asked to repeat it. After she got an adjustment. In the first section here, this is what her brain looks like. I wonder if I can try to blow it up. Let me try to blow it up a little bit so you can see it. This is the brain before the adjustment, showing multiple areas of activity all over the brain for the simple task of wiggling her left ankle. After the adjustment, this is now what we see. Focal points within the brain in the region that actually associates with the motor strip on the right hand side of the brain, which is responsible for movement of the left hand side of the body. When you have this kind of a reduction in overall unnecessary brain activity, it results in a more efficient brain. And so after the adjustment, her state was definitely far better than it was before the adjustment. So a chiropractor is not a bone doctor. So don't tell anybody that a chiropractor is a bone doctor. Even though we use the bones of the spine as our tools, it's really to effect a change in the whole nervous system. So think of chiropractors more as nervous system doctors, not bone doctors. Now we look at a chiropractic neurologist, which is what I am. Chiropractors realign the spine. That's what we're trained to do. We're all trained to realign the spine. But a chiropractic neurologist actually tries to rehabilitate different brain issues non-medicinally. And it's very fascinating to observe some of these things when they do happen. Now, chiropractic neurologists retrain the brain, and that's what we do. Whereas a chiropractor realigns the spine, and that's what we all can do as well. The conditions that I've worked with personally include the following: developmental delays, learning challenges, neurobehavioral disorders, neurodeficits, balance and movement disorders, and brain injuries. These are all things that we've experienced. At least at this office. And by treating them, most of these things have actually improved. Our vision is to identify subluxations wherever and whenever they happen, to provide a program of chiropractic care that's appropriate for each individual. The treatments that we offer here, they typically run about 12 sessions. That's what we usually have as a typical phase of care. A phase of care is how long you have a bunch of treatments before you do an evaluation and a reassessment of the condition of the situation, the person, to see whether or not we continue with them or we discontinue. Right? So that's what the phase of care is about. We always know that one treatment is not going to fix anything, so we try to put people on a program of care. The second thing is we try to educate our community. And we do this through classes like this, to the best of our abilities. Now, the key to success in getting and staying well is for you to take responsibility for your health and well-being. The key to success in getting and staying well is for us to take responsibility for our health and well-being. My phone battery looks like it's about to die, so let me just try to plug in a little thing to charge it. Sorry guys, I saw a warning on my phone that the battery is about to die, so I just need to give it a little juice here in a moment. My phone has a subluxation. I hope that does it. Okay. Let us continue, shall we? So, whose responsibility is it to take responsibility for our health? It's ours. We are responsible for our own health and well-being. We're actually responsible for the health and well-being of our children. We are responsible for the health and well-being in some instances, even for our parents. People in my generation, we belong to what we call the gap generation, because we are standing in the gap between two generations. Between our aging parents, who are sometimes not able to take care of themselves, so they live with us and we take care of them, and our children, who are dependent children, who are young, and we have to help take care of their education and what have you, right? So we belong to the gap generation. We're right in the middle, taking care of both, hopefully appreciated by both. there are video testimonials on our page, on our YouTube page, or YouTube channel rather, that you can try to log into, so you can watch. Um, I know that some persons were having some challenges. I don't know if those challenges have been resolved, but you can try. So please let us know if you have been able to get to these videos. This one with Joy is my favorite one. I don't know if it's there, but hopefully it is. Now, for those of you who have been here with us tonight, just kind of checking us out, and you live in Jamaica. Well, you don't have to live in Jamaica. You can live anywhere you want. But you are interested in getting an examination to find out if what is going on with you is something that we can help you with, or to find out if you have any issues going on that need some assistance. So what we try to do is we say to persons, we will give you a discount if you have participated in the class. And to participate, all you have had to do was just to watch it and write your name in the comments. That's all we need to know, that you are there, so that we can have your name added to a list, so that when you come in for your examination, you can get your special offer. What's that special offer? For those who make appointments tonight, or not really making an appointment tonight, but you indicate your interest in having an appointment done. So that way our team can contact you, or you can send your information, so that we can reach out to you and get that set up. The discount that is being offered for that service is a 40% discount off that new patient examination if you're not already a patient of ours. You get a 40% discount just for being a part of this class. And that's how valuable we think this class is. Because by following the class, I think you will learn enough that you'll make better decisions for your health and be a better customer or consumer. But for existing patients, you will get a 20% discount off your update examination. Not that only, you will also get another 20% discount off one treatment per person that you refer. So if you're an existing patient and you refer somebody to our office, you get 20% off that treatment. If you refer 2 people to the office, you either will get, depending on whichever you want, because the numbers work out the same, you'll either get a 20% discount off 2 treatments, or a 40% discount off 1 treatment. I hope that makes sense. And so on. The last thing is that there's also a 10% discount off the next phase. We call it a phase discount. So once you've watched this class, then should you decide to continue with care and beyond your update examination, then we will put you on another program of care of 12 sessions, at the end of which we will re-examine you again. But those 12 sessions, whatever the cost is for those 12 sessions, including the exam, you will be given a 10% discount off that total cost. So I think that's a very good deal. We're at the end of the slides here, and if you want to connect with us, you can either do so on Facebook by going to GCN Jamaica, and please subscribe to our page, like our Facebook page, GCNJamaica.com, www.gcnjamaica.com. On YouTube, it's just Gardner Chiropractic. And if you did not know, we also have a class that we teach on a Tuesday evening at 8 p.m. on RGR 94 FM. Also on Facebook, provided they have internet in the studio. Called Back to Health Talk Show. It's a health talk that guides people back to good health. So it's a good show. All right. Let me bring up back the rocks here. Are there any questions from anyone, or is there any question that anyone would like to ask that we could probably answer really quickly before I turn in? I saw a question by Sir Holgate. What are the contributions? Please remind me what we're talking about. Contributions of what? Just gonna wait for you to comment in the chat. And if you're not able to comment at this time, no worries. You can feel free to comment anytime. But we're here for you. It's always a pleasure being able to hang with you guys. Nicolene has asked, will there be another class next week, Thursday? The answer is no. We do this class once per month, every third Thursday of the month, which means the next class is the 19th of October. So the 19th of October is the next class that we will have. All right. So I think that does it. Thank you so much. I wish you all the very best, and I appreciated having you guys join us tonight. Spread the word. Next class is the 19th of October. Put it in your calendars now so that you can be reminded of it. It's always a little bit different each class because we try to talk about different things. So thank you everyone, and it was a pleasure being here with you. Have a wonderful and good night.